So without further ado, I would like to introduce our conference co-chair, Dr. Ted McDonald. He is the academic director of the New Brunswick Research Data Center and co-director of the New Brunswick Institute for Research Data and Training, which is a newly established facility on the UNB campus to house administrative data for the province of New Brunswick. He is also a professor of economics at the University of New Brunswick in Fredericton. And he was designated a UNB Research Scholar for 2012 and 2014 and has been the primary investigator or co-PI on over $1.5 million of research funding since 2009. His areas of expertise include the health status and health services use of immigrants, rural residents, minority groups, and other subpopulations, as well as an ongoing program of research on the socioeconomic and demographic determinants of cancer. He has published his work in a broad range of academic journals and has also co-edited a book on immigration in Canada published by McGill Queen's University Press. Please join me in welcoming your co-chair, Dr. Ted McDonald.
Thank you. And that stuff didn't look that hard, I don't think. I can do that. So good morning. Thanks everyone for being here, and thanks to Nick, NB-SPRN, and the organizing committee, conference sponsors for making this first annual GovMaker conference possible. As Nick mentioned, I'll be your chair for the day. I'll be here to introduce the sessions, the panels, presenters, and at the end of the day, help to tie all this stuff together. I'm very pleased to be here today to explore the value of using data, be it for research, entrepreneurial ventures, policy making, and business decisions. I also want to highlight and celebrate the opportunity we have here in New Brunswick to seize the moment, to leverage past work and events that have led to today, to encourage people and the expertise in this room to make connections, to share ideas, to develop projects and identify innovative solutions to some of the province's ongoing challenges. This is something I care about a lot and something I've been actively involved with through both my research and my service to university and to the broader academic community. The mobilization of administrative data for research, economic development, and policy is something that is accelerating all across the country. In particular, there's been great progress already made in developing administrative data collected by federal and provincial departments to support policy relevant research and evaluation. And this includes data on our own health service use, our education and training, our income, our employment, our mobilization, and our migration, our mobility. In short, anytime we interact with government agency, valuable data are being collected. At the federal level, Statistics Canada is leading the way with major initiatives underway to link administrative data sets such as the Canadian Cancer Registry, the Vital Statistics Database, to each other, to census files, and to provincial health data. These data are being made available readily to researchers, including students, through the Statistics Canada Research Data Center Network, which have centers all across Canada. And as well, Statistics Canada is working with Citizenship and Immigration Canada and ESDC to bring immigrant landing records, data on EI claims into the Research Data Center Network. Justice and crime data are coming soon. And we even see some administrative tax data made available to researchers, kind of the final data frontier when it comes to administrative data. And from what I hear from our friends at Statistics Canada, we may even have an administrative census in 2021 to replace whatever we've got going now. One of the areas where we lag our American and European counterparts is in terms of business data, but it is now possible for researchers to get access to data on individual businesses in Canada through the Canadian Centre for Data Development and Economic Research located in Ottawa. And as far as I know, this is the only place where researchers get access to firm-level administrative data for research and policy. At the provincial level, almost every province has some sort of data platform in place through which researchers, NGOs, policymakers, and others can work with administrative data from the health system and elsewhere, such as hospital discharge records, physician billing data. The Manitoba Centre for Health Policy has been in operation for over 20 years and provides versions of 50 different linkable data sets across the spectrum of government operations to researchers and government people. In Ontario, the Institute for Clinical Evaluative Services is expanding their network by opening new centres in cities outside of Toronto. As well, in a pilot project, the government of Ontario, taking a big risk, is making its own income support data available to researchers all across Canada. And seeing the trade-off there that we are sort of handing control of our data over, but we are putting it at the hands of up to 3,000 or 4,000 researchers and graduate students to help us make better government program decisions. In Quebec, it's possible for researchers to get access to a variety of all kinds of linkable data. One particular example I found very interesting, it's possible to link pharmaceutical use data to an individual's driving record to see what the relationship is between multiple drugs and accidents. Here in New Brunswick, as Nick mentioned, we have our provincial government partners, and we have created the New Brunswick Institute for Research Data and Training, a provincial data custodian where a range of linkable administrative data sets are made available to researchers in a secure environment. We're working with a variety of organizations to develop linkable data sets to address important policy issues such as the identification of chronic diseases such as COPD and transitions into and out of long-term care. Even Canada's smallest province, PEI, is embarking on establishing their own provincial data center with the assistance of the New Brunswick IRDT. Funding agencies such as CIHR have recognized the importance of administrative health data for research and practice, and in their revamped funding model, CIHR funded patient-oriented research support units, and this is one of the programs that has brought over $1 million of funding to New Brunswick for administrative health data. They must have as one of their primary activities facilitating access to administrative data. So this is a CIHR national priority that this happen. There are also major initiatives underway to bring together all of this work. We are still at the early planning stages, but it will involve a collaboration among all of the provincial administrative data centers across Canada, Statistics Canada and the Canadian Research Data Center Network and its 26 RDCs, in a project that promises truly transformational developments for federal and provincial administrative data. In short, we are on the cusp of a revolution in the use of administrative data in New Brunswick and in the rest of Canada. But with great opportunity also comes great challenges, and even more importantly, the fundamental responsibility we have to ensure the privacy and confidentiality of personal data on our own health, our income, our education, and our employment. Just as importantly, the ethical use of the sensitive information must be ensured. Just as important, this is true not just of the government data that I've been talking about, but of all data that various agencies and organizations are currently collecting on us. So what we'll hear and see today will highlight these opportunities, these challenges, and these issues. There will be plenty of opportunity for questions, comments, general discussion, and I encourage your active participation throughout the day. We have a very exciting day ahead, a full day, and we will aim to keep everybody on track and on time. And with that, I would like to invite the first panelist to come up, and we'll get set up, and we'll begin the session in just a couple of minutes once we